Hi, my name is Julie Zeller. For today's lesson, I will be discussing Chapter 8 of our textbook, Communication and Nursing. Communication is used in our everyday lives, whether it's a conversation between friends or discussing the plan of care of a patient. Communication is essential in nursing. Nurses cannot do their job without the collaboration of an interdisciplinary team made up of doctors, nurse practitioners, care coordinators, physical therapists, and many others. Being able to communicate effectively to these providers is important because of the safety of the patient is at stake. Effective communication is described as being able to understand the other person without whining, making argumentative comments, or being forceful. Effective communication is about being clear and concise, speaking directly, being honest, and using active listening skills. It is also about asking for clarity if something is not understood. This is so important in healthcare because one misunderstanding can lead to harming a patient. Communication occurs constantly in healthcare. Human beings are naturally social, so it's no surprise if conversation between coworkers isn't always focused on patient care. Sometimes it's about recently cooked recipes, new restaurants in town, or a recent vacation. This is okay, as long as it remains appropriate in your work setting. Gossiping about coworkers, sharing personal information about your patients, and talking about what happened at the bar over the weekend are not appropriate work conversations. We must always be mindful of the conversations we are having, as well as how well we are communicating with each other. The physical acts of communicating goes hand in hand with nonverbal communication. Nonverbal communication is seen through body language. This often helps nurses to understand subtle and hidden meanings in what the patient is saying. This is also true for the patient towards nurses, so it's also important for nurses to be aware of the nonverbal signals that they are sending to their patient. For example, if a patient says that they are not in pain, but the nurse witnesses the patient to be guarding one area of their body, wincing with movements, or even crying, it is clear that the patient might actually be in pain, based on these nonverbal signals. We can also read someone based on their gait. Someone who is walking with a bouncy, purposeful walk reflects confidence and a positive attitude, as opposed to someone walking slowly or dragging their feet. Gestures is another nonverbal signal. A gesture can be something as simple as giving a patient thumbs up for making progress with physical therapy, or a patient tapping their foot with anxiety. Gestures can also be important when communicating with other healthcare professionals, like doctors or unlicensed personnel. When asking an unlicensed personnel to perform incontinence care or to test a blood sugar on a patient, it would not send a positive message if the nurse asked with his or her arms crossed. This would send a demanding, angry message to the staff member. Instead, ask with your arms at your side. Tone of voice is another element of nonverbal communication. Speaking softly may indicate shyness, lack of confidence, or even pain. Facial expressions is the most interpretive nonverbal element because the face is the most expressive. Facial expressions can tell the nurse if the patient is happy, fearful, uncomfortable, or in pain. It's also important for nurses to be conscious of their own facial expressions so they don't send the wrong message to patients. The last nonverbal cue is eye contact. Communicating begins with eye contact, so it is an important factor when communicating. Eye contact, when someone is speaking, suggests respect and an aspect of listening. Too much eye contact, like staring, can suggest disgust or anger. All of these nonverbal signals are important in all conversations. Now let's watch some examples of nonverbal communication. All you do is sit. Can you just do your job and help us out?
Sorry. Hey, Julie, thank you for helping me with cleaning the patient today.
You're welcome. One tool utilized in the hospital for effective communication is SBAR. SBAR stands for Situation, Background, Assessment, and Recommendation. Doctors can have about 30 patients under their care at one time, so it's possible they may not remember every detail about a patient. We use SBAR if we need to communicate to a doctor about one of our patients. It is a way for nurses to organize their thoughts, speak clearly about who they are and which patient they're referring to, the situation, what they already know about the patient, the background, the problem that they are experiencing with the patient, assessment, and what they need from the doctor, recommendation. Let's watch an example of SBAR.
Hello, Dr. Drake. My name is Julie. I'm one of the nurses on Unit 4B. I'm taking care of patient Sally Jones in room 402. I'm concerned for sepsis because her blood pressure is hypotensive to 79/43, has a heart rate of 102 at rest and a temp of 102.4. She came into the hospital 4 days ago for an elevated white count after a recent knee replacement. These vitals are new as she's been normotensive and afebrile since her admission 4 days ago. I think she's becoming septic because of her appearance and her recent vitals. Her incision is oozing pus, is red and warm to touch. I gave her PRN Tylenol as it's ordered and some cold packs to cool her down. Can you order a fluid bolus, some blood cultures, and antibiotics, please? And let me know if there's anything else that you can think of that you need me to do in the meantime. Thanks.
Communicating effectively to patients is just as important as to doctors and other healthcare providers. We use communication to build rapport with patients. Rapport is a trusting, harmonious relationship. This is essential in providing patient care. We build rapport by being empathetic towards our patients. Empathy is identifying with the way another person feels. An empathetic nurse is sensitive to the patient's feelings and the problems that they are faced. The nurse's job is to remain objective to help guide the patient towards a positive outcome and a positive attitude. Empathy is not to be confused with sympathy, which is where the nurse shares the feelings as the patient and projects them back onto the patient. This leaves the nurse with less room to be objective. Another important factor when communicating with patients is therapeutic touch. Touch connects people, provides affirmation, reassurance, decreases senses of loneliness, shares warmth, and provides emotional support. One little gesture can provide so much. Tactile senses are the most developed senses in human beings because it develops right at birth through mommy-baby bonding. It has been seen that the elderly long for touch, as they may be isolated from loved ones while being hospitalized or in long-term care facilities. They may also be recently departed from significant others who have passed and may be lonely. In these cases, therapeutic touch might be the one comforting thing that they desire. Therapeutic touch can be demonstrated as a hand on the shoulder or holding a patient's hand. Last, being able to listen to patients is very important when communicating with patients. Listening is a skill that requires hearing what the patient is saying as well as interpreting. Listening can only be done with full attention and concentration. Listening to patients will further guide the nurse on how to tend to their needs and provide them the utmost care that they need. The helping relationship exists among people who provide and receive assistance, such as a patient-nurse relationship. The helping relationship differs from a friendship as it is characterized as an unequal sharing of information, and the relationship is based off of one person's needs, the patient's. The 3 stages of the helping relationship are orientation, working, and termination. The orientation phase begins between the nurse and the patient. It includes setting guidelines and tones of the relationship as well as data collecting from the patient. Roles of both the patient and the nurse are clarified and agreed upon. The working phase is the longest section of the relationship. During this phase, the nurse and the patient work together to meet the needs of the patient, physically, mentally, and psychosocially. The two work together to meet the health goals of the patient. During this phase, care is provided to the patient. Last, the termination phase occurs at the conclusion of the relationship. This can occur at time of change of shift, at time of patient's discharge, or when a nurse leaves for vacation or seeks employment elsewhere. Hopefully, at this stage, the goals the nurse and the patient made together have been met, leaving them feeling satisfied and hopeful for the future. If not, there is often feelings of guilt or regret from the nurse. Preparation for the termination phase can be done by easing the transition from one nurse to another at change of shift. Providing patients with an explanation of the next course of action and what to expect can also be beneficial at this stage in the relationship. One nursing task that requires good communication is delegation. Delegation is the process of a nurse to direct another person to perform a nursing task. This is usually to an unlicensed personnel. When delegating, it's important to remember the 5 rights of delegation: right task, right circumstance, right person, right supervision, right direction. Delegation can also occur from licensed provider to licensed provider, such as doctor to nurse or nurse to nurse. In either situation, it's always important to remember these 5 rights. It's also important to remember everything we've previously discussed about communication, being respectful, effective, and remembering those nonverbal signals.
Now let's watch some examples of delegation. Taylor, I need you to give Mr. Jones some Tylenol for me, please. I just called an RRT on my patient who's decompensating, and I need to give him some Tylenol. Can you please give it to him for me, please? It's just Tylenol.
No, I can't actually. I'm not allowed to administer that. But you can ask one of the nurses. I just ordered metoprolol for Mrs. Rodriguez. Her blood pressure is elevated. Can you please administer and recheck in an hour and let me know?
Absolutely, Dr. Drake. Now let's watch some examples of different delegation conversations. Taylor, I need you to go get the blood sugar on Mr. Smith right now. I need his sugar before he eats and his lunch is on its way.
That is not an appropriate way to ask me. I will do it for him anyway.
Hey, Taylor, can you get the blood sugar on Mr. Smith in room 12 in about 15 minutes, please? His lunch is going to be here soon.
Of course.
Like mentioned earlier, human beings are naturally social. Conversations happen in workplace environments all the time, whether they are related to patient care or not. And that's okay, but it's important to remember to keep those conversations workplace appropriate. Conversations should not include gossip or inappropriate activities that occurred outside of work. Next, HIPAA is the most important factor when having casual conversations with coworkers. HIPAA protects the privacy and confidentiality of patients. Nurses and other healthcare professionals are not allowed to talk about patients' conditions to anyone who is not involved in the patient's care. Last, it's important to remember your surroundings. In the break room, away from patients, it is appropriate to talk more about personal things. However, HIPAA still and will always apply in this situation. Even in the break room, it's not okay to talk about patient conditions.
Now let's watch some different work conversations. Did you see Haley at the bar this weekend? She was so wasted. I heard she went home with a random guy too. She's such a party animal.
Yeah, I heard she's sleeping with Dr. Chong and Dr. Drake.
Hey Greg, I'm starting night shift next month. I know you work nights sometimes. Do you have any suggestions on how to adjust my sleep cycle?
Yeah, blackout shades really helped me. I'll send you an article I read from the ANA Journal of Nursing on healthy ways to survive night shifts.
Cool, thank you.
You're welcome.
Now let's break into groups of 2 to practice effective communication